Is it possible to have a mild form of cystic fibrosis? Imagine a condition that can vary so much that some people might not even realize they have it until years later. That's exactly what can happen with cystic fibrosis. While many think of it as a severe disease affecting the lungs and digestion, there is a milder version called atypical cystic fibrosis. This form can be quite different from the classic type. It may involve only one organ or cause symptoms that come and go, making it harder to spot early. Some people with mild cystic fibrosis might not be diagnosed until they are teenagers or even adults. Cystic fibrosis is a genetic disorder caused by mutations in the CFTR gene. This gene is responsible for producing a protein that helps regulate the movement of salt and water in and out of cells. When the gene is mutated, the resulting protein doesn't work properly. This leads to thick, sticky mucus building up in organs like the lungs and digestive system. The severity of symptoms depends on how much the CFTR protein's function is affected. In milder cases, some function remains, which means less mucus buildup and fewer symptoms. People with mild cystic fibrosis might experience occasional respiratory issues, like a cough or sinus infections, but these are less persistent than in classic cystic fibrosis. Digestive problems might be mild or intermittent, such as occasional bloating or greasy stools. Some might have repeated episodes of pancreatitis or nasal polyps. Fatigue and recurrent infections could also be part of their experience, but often the symptoms are subtle enough that they go unnoticed or are mistaken for other conditions. Diagnosis can be tricky because symptoms are not always obvious. Many cases are identified through genetic testing or sweat chloride tests, which measure salt levels in sweat. People with cystic fibrosis generally have elevated salt levels, even if their symptoms are mild. Without screening, mild cases can be missed, especially if symptoms are sporadic or mild. The good news is that even mild cystic fibrosis requires medical attention. Regular checkups, appropriate treatments, and monitoring can help manage symptoms and prevent complications. Early diagnosis is important because it allows for better health outcomes and quality of life. While mild forms tend to have a better outlook than more severe cases, they still need careful medical oversight. Remember, each person's experience with cystic fibrosis is unique, so personalized care is essential. If you or someone you know has symptoms or a family history, talking to a healthcare professional is the best step to understand individual risks and management options.